Welcome. You're listening to the Keeping Ashland Healthy podcast, a podcast production of the Mental Health and Recovery Board of Ashland County, Ohio. Thanks for joining us. And thank you again for coming back to the podcast here at the Mental Health and Recovery Board. We are in studio. We are in the middle of a series where we are introducing Ashland community to some of the board members that serve on the Ashland County Mental Health and Recovery Board. This is a Dr. Ashley and the Boss podcast, but Dr. Ashley is not with us, sadly, in studio today. She had another, she tells me, more important meeting. But we do have in studio board member Dennis Dyer. Welcome, Dennis.
Thank you, Mr. Ross.
So I don't know if I believe Dr. Ashley, but I had to at least pretend. So I will have to ask you all the questions. Normally, for the folks that have been listening to this series about the board members, we go back and forth. But you just have me today, so hopefully you can bear with me.
Okay, that's fine.
All right. One of the things I've emphasized with our guest in the audience is that one of the requirements to serve on the Mental Health and Recovery Board of Ashland County is that you are a county resident. So let me ask you, Mr. Dyer, how long have you lived in Ashland County?
I moved to Ashland in 1981 in January.
1981. So I'm doing some math. That paired 42 to 43 years, perhaps.
That sounds right.
So you might know a thing or two about the Ashland community?
I think I'm starting to catch on now. You know.
I say that, and I emphasize it because as listeners, learn more about our board members, hopefully, that comes through that the folks that are representing them on the board have been in this community for a long period of time, and they really do know a lot about what's happening in Ashland County. So since you've been here 40-some years, how long have you been involved with the Mental Health and Recovery Board, though?
Well, I started at an agency as a director. So I was doing that for about 4 years. Then the Mental Health Board formed up, and my agency became kind of under that new board, the Mental Health Recovery Board. So that would have been 1990, I guess.
Right. So even when you were at the agency level, you still had quite a bit of interaction with the board, but then that role changed after you retired from the agency that you were director of. Then you started to serve on the board for the last, what's it been, a couple years now?
I believe it's about 2 years.
Yeah, yeah. So there's been kind of a nice continuity between seeing, how the services play out as a contract agency since you were the director, and now the other end of it, as a member of the board, you kind of see how the agencies present their information, and you're on the funding side. You're looking at the community needs and maybe the best ways to meet those needs. So you're kind of seeing it from a different angle.
That's for sure.
Yeah. Well, one of the things I think the audience is always interested in, because you can obviously do a lot with your time, Mr. Dyer, but you chose to dedicate at least some of your time to service on the board. And so tell us, if you could, just a little bit about your motivation. Why did you want to serve on the Mental Health and Recovery Board?
Well, obviously I had an interest in at least part of the work of the board, and that I was in the alcohol and drug field for close to 40 years. So when you retire, you need certain things to keep yourself busy and to be involved with. And I had it in mind to do some kind of volunteer work or board work. And then I saw some boards that could be nice, but I don't really know anything about that, or that's not really my skill base or my knowledge base. And what I knew a lot about was the mental health and alcohol and drug field. And as you know, I interacted a lot with Mr. Ross and other people at the board, and that they fund us and they monitor us and kind of work with us to help us provide service in the community. So I knew a lot about that end, and I knew some about the mental health board end. So I thought, well, that's a natural. Yeah. And the audience might or might not know it, but there's categories of different types of people that are required to be on the board by statute.
Yes.
And I believe one of them is alcohol and drug professional or mental health professional. So being an alcohol and drug professional, I also fit that slot.
Yep.
So it really seemed like a perfect match to take the kind of skills and knowledge I had and be able to serve on the board.
Yeah. And let me unpack that, because Mr. Dyer raises an important point. Not only are the Mental Health and Recovery Board members residents of the county, but they have to fit certain categorical buckets, if you will, that revised code requires. And again, this is to help to ensure that, again, all the important groups are represented on the board. So he mentioned one or two, actually. We have to make sure that those that serve somebody, and it could be the same person for this category, they're an expert in mental health and or substance use disorder. So we're looking for clinicians with experience doing that. But we also have to have folks on the board that maybe have had a loved one, family member that has struggled with substance use and or mental health issues. And then we're also asked to ensure that we have board members that they themselves personally have struggled either currently or in the past with mental health or substance use issues. So we call those, the fancy term for that is the categorical appointments, and we have 6 of those. But as I say, in the one instance, when it comes to a professional, it could be the same person that fulfills both roles as both a mental health and a substance use professional. So thank you for saying that, Dennis, because that gives me a chance to unpack that a little bit, and just wanted the audience to know.
Yeah, if I might say, I think that's one of the great things about this board. I'm sure a lot of people are aware that certain types of boards are kind of prestige appointments,
Yeah.
or people in the community are impressed by the fact that you're on a board. But for this one, everybody there seems to be there with a reason.
Yes.
There's a personal experience, a family experience, a professional background, educational, whatever, that they bring to the board certain special skills and motivation. So I think that makes this board, work much better than some boards do.
I couldn't agree more. And to that end, could you tell us maybe a little bit more about your specific role on the board currently, and what does it kind of look like for the audience?
Well, of course, I attend all the full board meetings, and then there's, committee meetings to handle certain business prior to the main meeting. So that's really one of the main functions, is to attend and stay abreast of, any kind of news or activities or issues or needs in the community. But one of the biggest roles is to help review applications for funding, the type of services that might be, purchased by the board or paid for by the board, and to try to kind of evaluate what's the best choice, because obviously money is always short and there has to be judgments. So although, a lot of our staff does a lot of the evaluations and workup, in the end it comes to the board, and we need to decide, what kind of funding is going to be provided, and maybe even pick programs sometimes. But
Yep. And that is a key role that only the board can do. And as Dennis said, and most folks would probably understand, the board, like any other organization, has limited funds. So the needs are always greater than our ability to meet those with the funds we have. So sometimes those decisions are not the easiest to make in terms of, funding program A versus program B, or agency A versus agency B or C. So that's a lot of work that you guys do.
And I guess another area is to kind of be an ambassador for the board.
Yes.
And to present credible board members to the community. I think I got to be known fairly well throughout the community, including, clients and people that got services. So when they see someone like me or another board member on the board, they say, wow, that looks like that could be a good board, because they got some people that have been out there doing the work and understand the work, or in some cases they've been patients or clients themselves. So I think that really adds some credibility to the board.
Yeah, I wanted, you again brought up an ambassador kind of role that we haven't talked about with some of the other guests, and it's an important one. It's both receiving and giving. So one of the things we ask our board members to do, even when they're outside of a board meeting, even though it's not official board action, they're eyes and ears in the community. So whatever they're involved with in the rest of their lives, if they're hearing things that somehow pertain to the work of the board, substance use issues, mental health issues, we ask them to bring those experiences back for the board meetings, for the whole board to deliberate and talk about. And the flip side is occasionally you might hear something out in the community and you just know that not to be the case. Or you might know that there, for example, we do have a local 24/7 crisis line, and yes, we have that. Yes, there's a 988 option, but we also have a local number. So it could be sometimes just giving information out when you're in your normal life, when you hear or are presented with information that you just know that there's maybe a better or a different answer to. So we appreciate that ambassador role. That's an important one. This next question, this is one of Dr. Ashley's questions. She's not here, but I'm going to ask it on her behalf, and it's the something fun question. Just to break up some of the more serious questions I've been asking you, is to tell us a little bit about the best gift, and again, best gift according to you, that you ever received, and why that was the best gift.
Okay, well, maybe it doesn't totally fit the category because it's not a typical gift. And maybe it wasn't exactly in the fun category either, but it was that I was awarded the Martha Jordan Beacon Award.
Yes.
And David knows about that. I'd worked in the field all these years, and it was getting towards retirement. And the award basically is to a community member that served well in the community in the broad field of mental health and had some excellence or had done, a lot of good work in that area.
Yeah.
So it was very touchy to me. I don't think I really am really excited about real gifts. Material things don't really excite me that much.
Sure.
But that one, that was really big.
Great. Yeah, and you were certainly, in my opinion, a very deserving recipient of that. So, yeah, I remember that meeting where we were able to do that. And I think we were able to surprise you, if I recall.
Yeah, because I'd sat through like a whole bunch of these awards, and I'm thinking, oh, who could that be? I bet it's going to be so.
Yeah, that's one of the things we try to do when we do that, and that's something that we like to do every year. The Martha Jordan Beacon Award is at the board's annual luncheon is to announce that, and we really try hard to keep it a secret from the recipient, and we often need insiders, we call them, family and friends that can get us the information, and we can talk about the person without the person knowing it. So
yeah, well, you totally succeeded in that.
All right. This other question, I know you've been on the board for a couple of years now, so the work of the board, we do a lot of different things in terms of different programs and services. But again, your perspective, what work of the board do you think most positively impacts Ashland County?
Well, I think that the board carries out its responsibility of organizing and monitoring services and funding.
Yeah.
So obviously those are of great importance, but we support, the most important is the direct services.
Yeah.
The eyeball to eyeball, on the ground, emergency service, long-term service that clinicians, counselors, case managers, and the workers that work in the agency. So we support them, and we allow them to exist. And we have to go through all the funding hoops and stuff from the state and keep it all organized and whatever, which isn't always the most glorious. But
right.
I guess without us, they couldn't do that either. So
that's right. It's
really that we support those people doing the direct services in the county.
No, that's a great answer. And again, we're in studio with Dennis Dyer, Mental Health and Recovery Board member. Final question, Dennis. What do you want our listeners to know about the work of the board? We've talked about several different things, but any parting words that you think you just want any of our listeners to know about the work of the board?
Well, I think I described that somewhat in the prior question, but I think another piece of the board's work is when things go wrong. When things go right, it's great, but every once in a while something blows up, maybe an agency starts to malfunction, or, agency staff aren't perfect. Maybe they start to malfunction in their work, or an agency, is improperly operating. So we're here to monitor and kind of put that fire out, or, fix that if that
Yeah.
kind of problem occurs. Maybe I shouldn't be bringing that up, but I
No,
think it's an
no.
important role,
That level of oversight, and I think we want the community to know that
Yeah.
if the services that the board intended and funded aren't being delivered in the way or the manner that we expect them to be, then yes, well, the board has a responsibility then to intervene.
And I think of the board, mostly through our staff, because we don't go and interact with the agencies, but through those efforts, I think we really do a good job at that. And I think Mr. Ross does a good job at
Well,
that.
I appreciate that. But yeah, I will say there has been very few occasions, but there has been board-to-board communication between our board and the board of one of our contract partners over the years. We've done that. So occasionally things rise to that level, but as you say, for the most part, I think we're pretty pleased with our contract partners, and we're able to intervene and course correct much sooner than something of that nature. But that's an important function of the board, that oversight.
It may be preventative, too, because
Yep.
I know the board directors here, it's not a large county.
Right.
They know the staff, and they know the programs, and they're in the community. So I think it's a preventative thing. They know, everybody knows that there's somebody there that's an authority that is going to make things right and prevent things from getting off track, too.
Yeah. Now, I appreciate your time, Mr. Dyer, and I thank you for answering all these questions, even the fun questions.
Sure.
All right. Thank you. Thank you for listening to another episode of the Keeping Ashland Healthy podcast. The podcast is a production of the Mental Health and Recovery Board of Ashland County, Ohio. You can reach the board by calling 419-281-3139. Please remember that the board funds a local 24/7 crisis line through Appleseed Community Mental Health Center. It can be reached by calling 419-289-6111. That's 419-289-6111. Until next time, please join us in Keeping Ashland Healthy.